Okay, good afternoon, everybody. Welcome. We're going to get started again for our new IMPER system, the Nebraska Prevention Information Reporting System. David is going to start us off.
All right. Good afternoon, everyone. Again, IMPERS, the Nebraska Prevention Information Reporting System, is an internet-based reporting system that collects and reports prevention activity data in the state of Nebraska. The system collects community, regional, and state-level data from recipients of federal and state prevention funds administered by the Nebraska State Department of Health and Human Services, Division of Behavioral Health. It is also used to measure progress towards meeting community goals and for reporting state progress in meeting the prevention-related national outcome measures, or NOMs. The users of IMPERS are the recipients of the Substance Use Prevention and Treatment Block Grant funds, which use the system to report data for federal requirements. Subsequently, the state of Nebraska uses IMPERS to manage the Nebraska Behavioral Health Prevention System, funded in whole or part by the federal block grant. Entities reporting data into IMPERS include community coalitions, private non-for-profit agencies conducting prevention efforts, regional behavioral health authorities, and other funded entities. Additionally, based on the data entered into the previous version of IMPERS website, it offers reporting functionalities that allow for the assessment of a coalition's progress by using the Strategic Prevention Framework. The Strategic Prevention Framework relies on a community-based risk and protective factors approach to prevention and a series of guiding principles that can be utilized at the federal, state, tribal, and community levels. Finally, IMPERS provides the reporting capabilities for the federal block grant. The reports provide numbers served by individual-based programs or population-based programs and strategies, numbers served by intervention type, and use of evidence-based programs and strategies.
So good afternoon, everybody, and hopefully the information that David's just covered in review of what our IMPERS system is used for is not coming as a surprise. And today's focus is going to be really looking at the new IMPERS system that we have built with our DHHS partners on the Information Systems and Technology team. And so we're bringing the new IMPERS system in-house. So it has been developed and it will be hosted by DHHS, which we're very excited about. And we will be wrapping up activities, and we'll talk a little bit about this later, the activities in the Orion healthcare-based IMPERS system. But as we are looking forward to the use of this new system, we wanted to highlight today in the training different areas of enhanced user functionality, as well as what we think is a very intuitive type of dashboard and approach to being able to navigate very easily through the system. So we're going to do an overview of each of the different areas and the different roles within the system, and then we'll do a demonstration actually in the test environment. And so Gretchen's going to start to walk us through what you can expect to learn on today's training.
Okay, what we are going to go over today is username and password setup, level of access, add, edit, delete activity, coverage areas, demographics, funding source, fidelity questions, and add, edit, delete occurrences. Some of you may have already done this. Those who haven't yet, that's not a big deal. This is for the first-time user setup. On that Go Test URL, this is for test site only. So this will be for today and tomorrow that we encourage you to go in and just mess around on the test site. So how to start off, you press the first-time user button and you will be taken to the self-registration page. The one thing that I want to point out on this page is after you get your username and password set up down the road, if you happen to forget or misplace what that was, you can press help, I forgot my username, or help, I forgot my password in this login, and it'll help you get everything set up. This is the page that you will see after you hit the first-time user. You're going to need to fill out this account information, your first and last name, your email address, you confirm your email, then you can choose your username and password, and then it's going to have you select 3 security questions. These 3 security questions will be used if you forgot your password and need access to reset that. Once you have completed your registration, send an email to dhhs.dbhnpirs@nebraska.gov and provide the following information: your first and last name, the user name that you have created, your email address, and your organization that you belong to. After we get this set up, you will be notified and you can begin using the system.
So I've typed the email address in on the chat, and so everyone should have that viewable, just for reference in case you don't have your manual handy or something else that has referenced that email address. So again, you'll want to send that information in so that way we can finish getting you set up. As Gretchen mentioned, if you don't have an opportunity to have already done that or to get in today or tomorrow, don't worry, we'll be able to get you set up in the actual production environment so that way you can be in the system. So some general information before we get started with the overview. Just wanted to let folks know that since this is an internet-based system, you actually can access the system from any desktop, laptop, tablet, or phone in which you have internet access. And so the display will be generated onto that screen for your mobile device or whatever size screen you have, and it will be optimized to be able to have the best kind of viewing picture for you. That being said, we know that sometimes mobile devices can have fairly small screens, so you might want to maximize that screen by using a landscape view. One of the other things to note is you'll want to save your work frequently. You'll want to save on each page as you're going through and doing data entry. The system will time out after 60 minutes of inactivity. So again, you'll want to make sure to save so that you don't lose work that you've entered. If you have any issues, you can always start with those subject matter experts within your organization or at the region level via your prevention coordinator. We encourage folks to kind of make themselves known if they've got that expertise within the system, so that can be that first line of resource. If there are issues that come up, you may also contact our DBH staff via an email to the same address that had been shared in the chat box, and that's the dhhs.dbhnpirs@nebraska.gov. One last thing is we have a feature which allows you to export different information from the NPIRS system, and so there will be an Excel button that will demonstrate and show you as we go through the overview, but also you can filter on different icons by clicking on the column name. We have 3 different security levels, and permissions are based on the security level that is designed for each of the organizations, the regions, and the state users. And so part of the user sign-up is actual designation of what that security level type is. Organizations and those users will have the ability to view, add, edit, and delete activities for your respective organization or organizations if you may be assigned to multiple. Regions will have those same activity abilities with view, add, edit, delete. They will also be able to unlock activities for any organization or any region member to which they are assigned in their catchment area. And the other thing is, once the initial users have been set up, regions will also have the ability to help set up and maintain users and those permission roles, again, for their region and their assigned organizations that they contribute funding toward. And then at the state level, again, we have those same activity permissions to view, add, edit, delete. We're also able to unlock activities and set up and maintain users and roles. Unlocking activities would need to happen after an activity has been completed and locked down, and we'll explain that a bit more, as well as show you a demonstration. The other area of responsibility for us as state users are to maintain the overarching groupings and the system drop-downs that are across all of the different options and data fields within the set, as well as being able to gather feedback and input from all of you to be able to make this system the best that it can be, and to work with our IS&T team over time to continue to add in different enhancements that, again, help with the overall data collection and reporting for your use. We really want this to be a system that you feel is your system. We have been very lucky to have had your feedback and input that really has been used to help understand ways in which to improve the system. So we're excited to be able to go through this overview with you and demonstrate some of the areas of improvement, such as some pre-built logic behind the scenes to help with accuracy in data reporting and data collection. We also, again, have what we think is a very intuitive navigation through the system with a nice dashboard and homepage that I think you'll find very useful. So without further ado, we'll get into the overview.
After you log in, the dashboard is going to be the first thing that you see. The dashboard is the landing page where you'll begin working with activities. A list of activities for an organization, the date of activities, and the status of activities can be viewed at a glance. Using the buttons provided, you can add, edit, and view details of activities and activities occurrences. The dashboard view will change depending on security level of users. The data on the dashboard can be expanded and collapsed using the plus or minus buttons provided. You can see in this example, you have the name of organization. There's a button to add activity. You have the list of activities. Below the list of activities, you have the page number to get to different activities. You have add, edit, view occurrences, export activities list to Excel, view established activities, edit incomplete activities, view completed occurrences, and view completed activities. On this next page, you will see the organization dashboard. Users assigned to the organization security level will only see activities for their organization. Next is the region dashboard. Users assigned to a region security level will see their organization and their associate activities. Activities. From the dashboard, using the View button, you can view the information for a specific activity. You can review each page of the activity and move from page to page using the buttons at the bottom of each page. When you have finished viewing the activity, you can return to the dashboard by using the menu on the left side of the page by clicking Dashboard and then Home. Adding an activity begins at the dashboard by pressing the Add Activity button. This will take you to the first of the 3 pages required to record the details of your activity. Each page must be completed and pass the system edits before you will be allowed to move to the next page. At the top of each activity page, you will find that the activity ID, region, organization, date entered, and enter by. This information is static and cannot be changed by the user. The activity ID and date entered are assigned by the system. The region, organization, and entered by information are diverted from the user. Page 1 of the activity contains general activity information. Each field is completed using the associate dropdowns. If you make an incorrect selection in any dropdown, you can correct the error by using the X next to the selection. If the activity was held at a physical location, select yes and fill in the physical location of the activity. If the activity was not held at a physical location, you must add region, county, city, or zip code of the coverage area. For instance, in this example, Scottsbluff as a city will be added. To do this, select from the drop-down arrow and type Scottsbluff in the city field and press Add City. After adding the city, it will automatically populate the region, county, and the list of zip codes that are in the city of Scottsbluff. If the coverage area is one of the zip codes of Scottsbluff but not both, you can easily remove the one zip code by pressing Remove button on the far right. The fields below will automatically populate based on the particular activity selected. The evidence base, intervention type, and strategy are shaded in blue, so those you cannot change. They will already be filled in for you. The remaining fields are required and must be populated using the drop-down. The only one that's not required is the secondary problem. You do not have to have a secondary problem to move on. After you've entered the information, you can save and return to the activity later, or you can press Save and continue to go to the next page. Page 2 of the activity contains information about the demographic population served. On this page, you are allowed to use the arrows next to each field to increase or decrease the counts in each field. You are also allowed to type directly in each field. Upon the save or save and continue, the information entered will be evaluated to ensure the counts of each group are matching. If you would look at the total participants, you do not have to add up each column yourself. It automatically does it for you, depending on the numbers, the counts that you put in for each one. After you complete the ethnicity and age categories, you can press Save and continue. Page 3 contains information about funding source and the fidelity questions. Press Add New Funding Source and use the drop-down menu to select the funding source. Please note, if there are more than one, the percentage total must equal 100%. If the activity has occurrences and they have not taken place, press Save to get back to the dashboard and go home. If the activity has occurrences and they all have taken place, answer the fidelity questions and press Save and Complete, and the activity is now completed and logged. To get back to the dashboard, you can press Dashboard and press Home. On this third page with the funding source and the fidelity questions, this is to be saved for when all the activity is complete. You have to fill out the funding source and the fidelity questions to be able to save it. We'll go over that more when we do the live demonstration for you guys.
So one of the additional things that you can do is edit an activity. So again, wanting to make this very useful for you to be able to get in and really have ownership within the areas of information that you've entered into the system. Anything that shows that status of incomplete will allow you to edit that information, or any users who have access to those activities for your organization. And so you can hit that edit button, and then you can update any of those fields that Bridget just went through that need to be that Gretchen went through and needed to be updated. Now, once something is complete, if you hit Save and Complete, at that point it will go to Completed, and that will be locked. And as you can see on this slide, there's no longer an option for edit. At that point, you would need to go to one of your region or state super users to unlock the activity, in which case it will take it back to a status of incomplete. And again, that edit button will be available for you to make changes and then to save and complete once those changes have been made. So again, you can delete an activity as well as edit it as long as you have that edit button. If you do not have that edit button, because it has been completed, you will need to have that activity unlocked by a region or a state level user.
If you need to view an occurrence, locate the activity on the dashboard, press the occurrence button, and then press View the View button on the occurrence you want to view. If you would like to add an occurrence when an activity requires multiple occurrences, find the activity on the dashboard and press the Occurrence button and then press New Occurrence button. If the activity has no new participants, press the No New Participant button and enter the occurrence date that the activity has occurred. This will take the user back to the activity. If you do have new participants for that activity, enter in the occurrence date and the number of new participants in the demographic. Press Save and you'll be taken back to the occurrence detail page. The one thing that you can see is on the right, it has the total of all the occurrences. If you have new participants just for this new occurrence on this date is where you would enter them in on the left-hand side, and then on the right-hand side, it would add to the participants that you had at an earlier date for that activity. If you need to edit an occurrence located on the activity dashboard, press Occurrence button and then press Edit button on the occurrence if you want to change. If you need to delete an occurrence, locate the activity on the dashboard, press the Occurrence button, press Edit button on the occurrence you want to delete, and you can press Delete Occurrence.
So Gretchen has taken us through an overview of the main features of what the system will allow you to do to be able to view, add, and edit, and delete different activities for your organization. And so a couple of things, we've sent out a manual. That manual in its draft form included some of the admin level that really is just at the state level, but again, it gives you a good idea and a good sense of what the system in the background is capable of doing and how we'll continue to coordinate with you all as there might be new evidence-based practices that come up or new activities that as a state might need to get added to the list. And so we'll keep this manual up to date. Right now, it really is very much in a draft form. In addition to a review of the user roles as well as those steps to be able to add and edit, et cetera, we've also got a list of different error messages that the system might kick out to you and why you're getting that error message. We've got a data dictionary that helps to define different funding source options, intervention types, et cetera. We also have a glossary. This will continue to be a document that we continue to build on. As we have different enhancements over time in the system, we'll update the manual to include those changes. But at this time, we'd really like your input. If there are things that are not quite clear, things that we could further describe or detail, we'd like your input on that. So as you're looking at that manual, if you've got notes and things like that, please feel free to pass those along to us at the email that has been given to you, that dhhs.dbhnpers@nebraska.gov. The other thing that we want to make sure is just, again, as the system is dynamic and we continue to make improvements within it, we'll look at the reports. If you've got feedback on what reports would be helpful to you, we'll be keeping a list of those and working as a team to prioritize the rollout of those reports that we'll be working with IS&T to develop and to roll out. A report training then will be done at a later date. Our go live with our new NPER system on the state site is going to be August 1st. And so you've received some different notes regarding the activity closeout from fiscal year 18. So those activities from fiscal year 18, which is anything up to and including June 30th of 2018, should be entered into the Orion hosted NPER system that you had been using. All of those activities need to be closed out by August 17th of 2018, which is when the system will shut down. But again, our new system will go live prior to that. But that will be for use of entering activities for anything July 1st, 2018 and beyond. So as of August 1, you'll be able to have access to get in and to start entering in your activities from this month of July 2018. Additionally, we would ask for any feedback that you have on the manual to be submitted to us at the email website by August 17th, in addition to the closeout of those activities from fiscal year 18, so that way in early September we can release a more final version 1 of our user manual. Again, if there are areas that as you're looking through could be expanded upon, please let us know that. If there are items that may have been missed that you would like a section on, again, please let us know.
One thing I want to add is you guys have been given the test site information. Like Heather said, we go live August 1st. So at the end of the day on the 31st, the test site will no longer be active, and we will email you all the production site information. If you have registered before our go live date, you will not have to register again. If those that don't want to register till after we have the production site up, you also can wait for that.
So at this point, we're going to go ahead and open it up to any questions. So we'll give a minute or two. If you'd like to ask a question, please use the chat button. While we're doing that, we're going to go ahead and gear up for our demonstration. But again, please feel free to go ahead and type your questions into the chat feature. We were asked if we could put up the test site, and so we are actually putting that into the chat section for the test site login. And then again, on August 1st, you will receive notification when the production site is ready. If you have had an opportunity to set up your user account in the test site, all of those user accounts, including the applicable password, will be rolled over to the production for ease of your use. At that time, you will also then be deactivated from the test site. And we're doing this in part to help ensure that you're entering information into the right site and that those activities that you begin entering for July on August 1st, that you're putting those into the production site. So again, you will receive that link with a notice that the site is up and ready for your use, and you will use the same username and password. If you forget your username or password, similar to the test site, the production environment will again have the help, I forgot my password, or help, I forgot my user ID. So you'll want to make sure that you select your security questions and remember those answers. That will be your key to being able to get that information on username and reestablish a new password should you need that. All right, seeing as we don't have any additional questions, we're going to go ahead and we're going to pull up a couple of demonstrations. So Andriana is going to act in a role of an organization, and so as she logs in, her permissions have been preset, and they will actually bring up an organization such as what you would see, though it would be based upon your organization. So Andriana has created a fictitious organization, and so as she logs in using her username and her password for the system, her dashboard is going to display as an organization level user.
Hi, this is Andriana, and I just assigned myself as a Region 1 under the fictitious organization Power Prevention. As you can see, I have a list of activities that are incomplete, but to go through the demonstration from step 1, I'll do just that. So under your organization, I'm going to press Add Activity. And I'm going to, select an activity date. So I'm going to go back a week, July 23rd, and then select what kind of activity it was, or which would be the one that I created. It's fictitious as well. It's called Strikeout Opioids. Let me search that. Moment. Is this a recurring activity? Yes. And then if you had a physical location, you would select yes and fill out that information as such. At this time, I'm just going to select no. And in the coverage area, I'm going to go to Scottsbluff as an example. So I'm going to press this gold down arrow, select menu, and type out Scottsbluff, and it will auto-populate. Sorry. I will select it as a city, and it will populate all the zip code areas within Scottsbluff. If there is a location that if there was an activity and it happened in just one of the locations of that zip code within that city, I'll just remove one. And as you can see, as Gretchen said before, these are grayed out. These are static once the activity has been established. For my method approach, I will select youth and adult leadership activities. My target population, you have a whole menu to choose from. So I'll just select economically disadvantaged youth / adults. The primary problem, select prescription drug abuse and misuse. And just a note that the primary problem, you don't have to have one. It's not a required field, and also it cannot be identical to the primary problem.
And so, Andy, just to clarify, the secondary problem, as Gretchen had mentioned previously, is one of the only non-required fields. Everything else, including primary problem, is required, but that secondary problem is not.
Correct. Thank you. So I can add, and if there's others to add, you simply just click in that cell and you can keep adding more as the activity sees fit. If you have made a mistake, you just exit out or click on the X and it'll eliminate that secondary problem. And then you have the intervening variables. So I'm going to use select from just social availability. You can choose as many as you see fit within this activity.
So one thing to note that folks, as you're viewing this, may notice, on some of the fields we have that gold option for the drop-down, and on other ones it almost looks like it's going to be a text field, but then when you click in it, you have an entire menu of options to select from in the drop-down. Those where it's more open, they're actually multi-selection, versus those where there's the gold on the right side of the data field, those are single selection.
Once I have selected these cells and completed, I'm going to save and continue. If I choose not to, I can just save and continue with it later. But for this demonstration, I'm going to save continue to go to the demographics page. And this takes into account what the participation was. So I'm just going to drop in some numbers: 5 males, 5 females, one other, one unknown, and then the rate. So I'll for time 5 males, 5 Black or African American, multiracial one, other race one. As you can see, with the total participants in each category, they have to equal the same. So 12 for the number of served, 12 in the race. And then as I go down to continue with the demographics, it would also be the same. So for ethnicity, I will select 6 Latino and 6 non-Latino, and then you have the age group to select from. As I do this, you can tab and enter the numbers, or you can use the up and the increase value or decrease value on the right next to the select numbers. So 6, 6. So I just selected some numbers, for example, and this again equals 12.
And Andy, do you want to demonstrate real quick what would happen or what would display if you accidentally put that there were 5 21 to 24-year-olds rather than 6?
Sure. So if it's 11 and I press save and continue, it'll say at the top, sum of numbers served, race, ethnicity, and age group must be equal. So wherever they're not equal with all with the other groups, you'll have to correct that. So in this instance, it is the age. So I'll change it back to 6 to correct the count. And if you're done, you can press save, and then come back to it later, or you can press save and continue to go to the funding page and fidelity questions. So here is the funding source and the fidelity question. Right here, I'm going to add a funding source, and I'm selecting. Right now, it's equal at 100%, but if I have a few different funding sources, I'm going to select another by pressing Add New Funding Source. And I select that. And right now, they're at 100%, but you have to change that so they equal 100% at the total. So I'm going to do 50% for each funding source. And then you go and fill out these questions.
And you'll fill out the fidelity if it was the end of all occurrences, but as Andy had indicated, that for this activity there are reoccurrences, she's going to save, and then we'll add an occurrence before completing the fidelity questions.
This is where I was talking about the third page. Don't enter it if you have multiple occurrences unless the activity is completely done, because it won't let you save. If you're adding funding source, it won't let you save without answering those fidelity questions. So if you have multiple occurrences, wait till that activity is complete, and then you can enter in the third page.
So I'm going back to the same activity that I entered at 7/23/2018. I'm going to add an occurrence, then add a new occurrence. If you have no new participants, you can select that and say it was the next day. I can select no new participants, and then that will take you back, or that will, I believe it would take you back out to the dashboard homepage. But for this example, I'm going to add new participants for the next day. So I'm going to add 1 male, 1 female. And on the right, it will show an accumulation of the total amount of people that have participated under this activity with a new occurrence. So it'll append new numbers to the total count. And I'll select 1 white, 1 black, and then I'm keeping count that the totals remain the same for total participants, total rate, and then for ethnicity as well. And then I press save, and it'll show under this particular activity that I had two new participants. So I'm going to go back out to my dashboard because I want to complete this activity now that it's done. So I'm going to go back to the original date that I had initially started. And I'm going to go into Edit, And then I want to complete this activity, so I'm going to save and continue. And this is where we want to finish up the activity. So I'm going to add the funding source. Again, I'm just changing the percentages so that they equal total to 100%. And then how many sessions were actually held? Let's say 1. And then say, why did the sessions not match? And then I would select whatever that fits the criteria. So just say it was more convenient to have more or fewer sessions. What was the actual length? For this particular activity that was set up initially, it was 60 minutes. It just depends on your activity. This is held weekly. And then were all the topics from the planned curriculum covered in the session? I'd say yes, or you can say no. Did you make any adaptations to the former of intervention materials? Say yes. Reason for making adaptations? It just depends on what fits the criteria, what changes are made. So you can say it was more convenient to change the format of the session. Was the program conducted in a specified setting? Say yes. Did the person delivering the curriculum meet the specifications of the developer? Say yes. Were there any adaptations made to address the cultural appropriateness of prevention intervention strategy for a particular group? Say yes. Did you make any adaptations to the content of intervention materials? Examples of adaptation include adding content to workbooks, adding handouts, revising pamphlets, or changing the format of a public service announcement from a television advertisement to a billboard.
One thing I wanted to add is on the fidelity questions, they're only on our evidence-based activities. If it's not an evidence-based activity, you will not have to answer the fidelity questions.
Thank you, Gretchen. And I'll continue. And I'll say yes. Say updated images to current and or relevant. And then once I save and complete, this will complete the activity. So right here at the third one down, on 723, shows that it's completed, and the edit button is gone, so it is now locked. So now I can just view the occurrences, and if I need it to be unlocked, then I would have to contact the regent or the subject matter expert to unlock this activity if I have to make any edits on this particular activity.
So let's go ahead and look and see if there are any questions at this point. So we're going to stop sharing our screen momentarily. And we're going to check the chat room. So a question has come up about percentages versus dollars. And this is a really key point to thinking about how we are moving with the system and incorporating actually some type of electronic data feed between our newly developed electronic billing system that went live last year and then also this new prevention system that we've got built with our DHHS IS&T team as well. So one of the things that as we have to report on for any funding, we know that the electronic billing system holds our source of truth, if you will, for how much we have actually expended in each of the different areas. And because in the past there have been some discrepancies between the two systems, we're looking to be able to identify the best approach to be able to have access through the information that you all are using with the billing side of things, and then incorporating that back to each of the different activities and to those dollars, so that that way we can report in all the various ways by interventions, by strategies, et cetera. So as of right now, those percentages are in the NPERS system, And again, we're looking to be able to find that best approach and how to tie those dollars back to those percentages as we move forward. So if you have feedback and ideas, we're certainly open to those. But again, a lot of this is in hopes of making it where you're not having duplicate entry of different things for the dollars, and that really that source of truth is coming back to what is being billed and what is being paid and can be reported through that electronic billing system. So more to come on that. We're really excited that, again, that this is a DHHS-owned and operated system, so that that way, as we see opportunities for improvements and enhancements within the system, as well as that data integration with our other systems, we're able to work and have a vision of what that should be in order to pull all of your information together and have a very nice, robust set of reports. Any other questions before we begin the next demonstration? If so, please type those into the chat box now. All right, we've had one question come in related to an activity type, and the question is, if you have a monthly radio presentation, would I have that as a reoccurring event? So your activity would then have reoccurrences, yes, and so you would expect that you would have different reoccurrences. An additional enhancement in this system is that where previously you had to create a new level of information reported for every single occurrence, now those are all going to be linked together under that one activity, so that that way, hopefully that helps to reduce some of the burden of entering in data each and every time and helps to be able to have just a very efficient way of being able to add that ongoing occurrence. But yes, that would be an ongoing occurrence if you have a monthly type of activity. All right, so I'm going to go ahead, and this is Heather. I'm going to share my screen with you all so that that way you can see what we're doing as we log into the system here. So I'm logging in, and I actually have region permission, and so I'm going to be playing the role of a region coordinator or region staff member. And so as I pull up my information, you'll be able to see that the region level dashboard has each of the corresponding organizations to which I have access to be able to view. And so the fictitious organization of Power of Prevention that Andy had just gone through is located here at the bottom of my list. That being said, I want to also just show I've also got the addition of these roles because, again, I can actually add users, or I can change the different roles at that prevention coordinator or region staff member level. And so I can change different information by editing it. I can choose to edit and then make someone inactive, or I could actually even delete someone if they are no longer with the organization. If someone is on sabbatical, you might just want to make them inactive so you don't have to go through all of the steps of adding them again. But if something else happens where you know that they will not be coming back to be a user, you could opt to delete them from the system. Additionally, at a region level, I've got the ability to change the role assignment. So if, for instance, I have a region staff member who has my region admin user permission, but for testing purposes, I want to do something similar to what Andriana had done, I might want to edit that and move them to an organization level, again, just for purposes of training and looking at the system in that way. I will mention that if you're doing training, you're going to want us to reactivate your user account in the test environment so that that way you can put information in and you're not actually adding fake information into our real environment. So if you do have training or testing needs, certainly at any time you can let us know. So I can assign those user roles, I can add different people at that region level, but again, I can see all of the activities on my home page for all of my associated organizations, and then each of those activities that would be listed under those organizations. To have some information in the system, we did have information from a previous Orion extract that has been loaded in here. So there is some actual information here, but again, as you are actually putting in information, we always want that new data entry to be in the new system for any activities from July 1st and after. So for purposes of demonstration here today, I'm going to show you the power of prevention. So let's say I got a call from Andriana, and she said, oh, I accidentally put that there was one session in my Strikeout Opioids completed on the 23rd and the 24th of the month. However, I need to change that, but I already completed the activity. So at the region level, I can then unlock that activity, and when I click OK, it's going to go from this current status of it had been complete to incomplete. So once that is unlocked, it is then now incomplete and can be edited. So by going in there to edit that particular activity, I could then go across to all the different fields to get to my fidelity questions. I don't have any changes on the demographics or anything to be added there, but on the demographics, she has indicated to me that it actually needed to be 2 sessions. And so I can either make that change for her and save it because I have edit permissions, or I can simply let her know the activity has been unlocked, it is back to an incomplete status, you now have the ability to edit that, and then she could go in, make that edit, and then save and complete, and then it's back to a completed status for that activity. Again, if any changes were needed at the region or the state level, we would need to unlock that activity for her to be able to make that edit. Any of these where they're incomplete, you can, as Andy had mentioned, gone into edit to be able to look at, add occurrences, or to just simply view the information that's been entered. One thing I would recommend is that if you are not planning to make any edits, that you use the view feature, because when you go into view, which as a region I might most typically be doing, that is going to lock information down to the point where I'm trying to click on these and it's not allowing me, so I can't accidentally make any changes to this organization's information. So again, as best practice and not wanting to inadvertently make changes, that's a nice feature to be able to have, to just view each of the different activities that have been entered into the system, and then view demographics and so on and so forth through the information that had been entered on the part of the organization. And so then I would simply, if I want to get out, I just go back to my dashboard, to my home page, and once again, I'm returned to all of my organizations that I have the ability to view. You can subtract or add any of these to be able to display more or less information as you see fit or as you might need to review. And again, we're working to be able to build in different reports, and so eventually on your dashboard along the menu, we'll have features for reports and different reports that will eventually be listed. So I'm going to open it up to our group here just momentarily. Anything else at this point that we want to give the users information about or knowledge of that maybe we've not yet talked about?
There will be a help page that we're building that they will have option to select it on the menu on the left-hand side. That will give them the link to the manual that we are writing now, and also the email address dbh@nebraska.gov for them to reach out.
Great. So right within the website, you'll be able to feel like you've got a lifeline out there and quickly be able to send a note over for help. So we look forward to that help feature coming over here underneath along the left-hand side of our menu options. One additional thing on the screen that you can see here, and this may not be a great example, so I'll find one that actually may have some more activities. I think we'll use Andriana's here, the power of prevention. But you can see how many pages there are, and you can also change the number of items that you want to display on the page. So you have the options of choosing 5, 10, or 20. And so then with that, then you can see it correspondingly changes how many pages you have the option to toggle back and forth from as well. So we feel like we've heard and gotten a lot of feedback from you all, of which we're grateful, and we're really excited about this new system. We had mentioned early on the ability to extract different information by going to this Excel button that you can see on the far right side of the screen, to be able to actually export out information in a mechanism or format that you might be able to use in different ways. So we'll be interested in the ways in which you're using that, again, to be able to continue to get feedback for how we can continue to build in different enhancements and improvements in the system. And last but not least, we've got our logout to the system. If you hit logout, it'll take you back to this login page. And as we had mentioned, if you are a first-time user and you've not yet logged in, you'll want to go ahead and do that. We've given in the chat box the link to that. So if you've got a chance here after we wrap up our training, or for you multitaskers, maybe you've been doing it as we've been talking, to be able to get in and to use that self-registration. As a reminder, when you do that, as Gretchen mentioned early on, please also send your first name, your last name, the username that you have selected, along with your email, and the event that someone might be providing this information on behalf of several people, and then the organization, of course, in which you work. We look forward to all of you coming into the system, and I'm going to look back and just see if we've got any questions before we wrap up today's training. So there's a question about recurring activities, and how do you record fewer participants on a reoccurring activity? So as Andriana had demonstrated, if you have new participants, but it's a reduced amount, that's fine. You would just put in that new count of folks, and again, it would add to any other occurrences for a total account of that activity, but it does not need to, and in fact, it will always default to 0 in that new participant count. So if you have, a very large occurrence one time, each of those new occurrences, you will add in that new count of folks, which absolutely could be more or less than previous occurrences or sessions that you had. And so the overall activity, again, will track those across time for each of those occurrences, keeping a total accumulation of all occurrences. But anytime you enter in a new occurrence, it's just specific to that number of individuals and that count. So a question is, if we had a previous account, do we make a new one on this system? And I'm understanding this question to be user account, and the absolute answer to the question is yes. Because it is DHHS hosted, we have our own user account system for setup and for login. And so as of August 17th, you will no longer have access to the Orion system. We will be shutting that down at the end of the day. And so again, that's why we're asking for all fiscal year 18 activities to be put into that system from fiscal year 18. And then all new activities from July 1st or after would be entered into the new system. Again, the question being, if you had an Orion account, yes, you still do need to make a new account for the DHHS hosted system. If you make that while we have our test environment accessible to you, that will automatically get pushed over to the DHHS production site. However, if you don't have an opportunity today or tomorrow to do that and to set up your user account, you will simply do that and it will be right on the production account side.
The next question is, will we have the ability to copy an activity for a new group?
No, because what we thought was most of the information is pre-filled in based on the activity, and also because we have that no new participants button. For example, for the monthly radio ad, all you would need to do is just click add occurrence and click on no new participants, and that month is covered because they don't have new participants. It's reaching the same area. Because the system is has less information and less number of occurrences that you need to do, we did not provide the copy functionality, but that can be added based on needs.
And again, some of that logic in the background is simplifying information that you're having to put in. Again, trying to lessen the amount of time that you need to take in thinking about each of those different data fields, but making sure that you're very mindful and intentional about what you are putting in for each new activity that you do, so that that way the system can give credit for each of those activities in addition to any activities which may have multiple occurrences happening within it. All right, well, we don't see any more questions coming in. We're going to go ahead and conclude today's training. If you do end up having questions, please go ahead and email those questions to us. We appreciate your time today. Thank you so much for joining us, and we look forward to your use in the new system. Again, get in, feel free to explore today and tomorrow, and we will push out notification when the new system is ready for you to go in on Wednesday, August 1st. Till then, we hope that you have a great week, and we look forward to seeing your activities in the new system. Thank you.